my name is Cole, and I will be reporting for today's broadcast of a syndrome called Klinefelter syndrome. On today's broadcast, we'll be meeting with Dr. Hutchins and his insight on Klinefelter syndrome and ways to treat it. Then we will see Dr. Harms while he talks about his patient's life who was diagnosed with Klinefelter syndrome. I hope you enjoy our broadcast and get a knowledgeable understanding of how Klinefelter syndrome functions. So what is happening to people with Klinefelter syndrome? Why do they have this disease?
What is happening is they're born with an extra X chromosome, so they are male with two female chromosomes. What this does is affects how they appear and how their genitalia work. Among other things, for starters, they will most likely have a smaller sperm count and will be infertile. They also have enlarged breasts and produce very little testosterone, the male hormone, which, as I said before, will result in little to no sperm count, but will also have a small penis and testes. These people will also gain excess body fat, a lower sex drive, lack of energy, and little body and facial hair, including the pubic region. They are usually taller, with long legs and a short torso. Along with these, they will have trouble reading, writing, and communicating in general. It is also possible for these people to have anxiety and depression.
So how rare is this disease, and how does it come about? Why do they have Klinefelter syndrome?
This is one of the most common chromosomal disorders. It affects 1 out of 500 to 1 out of 1,000 males. It happens by chance. It is not inherited. What happens is if the egg gains one too many X chromosomes and turns out to be XXY, he will have the syndrome. There are random events that occur in the formation of the reproduction cells that decide if they will have this disorder.
Alright, that answers all my questions. Thank you, doctor.
My pleasure. If you have any other questions, feel free to ask me.
When was he diagnosed, and how did it happen?
Well, at first he was going around looking for a diagnosis and never really got one, other than to just give it time. Then eventually, one picked up on an idea as to what his condition may be. He had blood tests sent in and did some other tests on his heart and bones, and in about 2 weeks he was diagnosed with Klinefelter's.
How do you think he felt at the time he was diagnosed with Klinefelter syndrome?
He told me that he was actually kind of happy. He said that he didn't have to worry about going to all the different doctors just to be told the same thing.
What makes living with Klinefelter syndrome challenging?
Klinefelter syndrome is super hard to live with. You tend to have a lot of health problems, such as weak enamel on the teeth, also random aches and pains all over, horrible headaches, urinary infections, and an extremely sensitive digestive system.
What impact does being diagnosed with Klinefelter syndrome have on family?
He said that he had learning problems and communication problems, and that he was very shy with low self-esteem. Also, when his testosterone levels dropped, he got headaches and was very tired.
Was he referred to any different services when he was diagnosed?
No, he wasn't given any care or support. He has tried to start a support group, but it is hard because nobody replies.
What would you say to someone who is newly diagnosed with Klinefelter syndrome?
I would say just to try and find out as much info as possible. Try to get into a support group with others like you.
In order to treat Klinefelter syndrome, you must recall back to the reason why the patient has the syndrome. The syndrome results in a patient when they aren't fully developed correctly before being born, resulting in an extra X chromosome. With this extra X chromosome, the patient receives female-like qualities because of the lack of testosterone. The testosterone replacement therapy is great for curing many issues that arise from Klinefelter syndrome, including the increase in muscle mass and personal strength, increase in body hair growth, increase in the patient's sex drive, improving the patient's overall mood, and preventing osteoporosis. However, this therapy cannot cure patients' fertility issues and gynecomastia. If the patient is infertile and he wants to become a father of children, he can get the operation titled intraplasmic sperm injection done. During this process, the sperm is transferred directly from the testicle through a biopsy needle and into the egg. This allows the father to fertilize an egg and have his own child. Gynecomastia is a development of breast tissue among males. In order to cure this issue, you can go through plastic surgery. Plastic surgery is great in this case because it allows you to cut off extra and unnecessary material from the male breasts. It is also possible to treat mental and social issues within the patient. For example, you can hire specific specialists that work with the patient in order to boost their social confidence and their learning disabilities. If the patient is still in school, you can also ask their teacher or student counselor for support.